I'm Andy Levy, Professor of Endocrinology here at the University of Bristol. Our sensory systems continually protect us from harm. It's our sensory systems that tell us that our clothes are too tight, or that our shoes are rubbing, or that the water we're about to climb into or plunge our hands into is damagingly hot. If you manage to sit completely still for about half an hour, you probably develop a pressure sore because the blood supply to the tissue against the chair would be compromised. And even when we're asleep, it's our sensory systems that make us continually wriggle and move about so that our tissues remain healthy. When it's working as it should, our nervous systems are remarkably sensitive, and outdoors, if a tiny insect lands on you, you immediately brush it away without thinking. And damage to the nervous system is what causes the horrific tissue damage sometimes seen in conditions such as leprosy. So it isn't really surprising that examination of the nervous system, muscle power, and also the various components of the sensory system is a completely routine part of clinical practice on the wards, in outpatients, and also surgeries. Now, our peripheral nervous systems are sensitive to touch, pain, temperature, proprioception, which is joint position sense, and also vibration. And it's this last sense, vibration, which is often the first one to be lost when peripheral sensory nerves are damaged. The biggest cause of peripheral nerve damage is diabetes. Diabetes not only affects about 2.5 million people here in the UK, but numbers are increasing around the world. It's the primary cause of about 75,000 admissions to hospital in the NHS each year. But more than that, it complicates other admissions and prolongs the length of stay. Because of nerve damage, diabetics have a 1 in 7 lifetime risk of foot ulceration. And foot ulceration, as well as costing about £8,500 to treat each one, predisposes to further ulceration and ultimately to limb loss. Diabetes knocks about 10 years off average life expectancy, but more than that, it's just the cause of enormous misery. Testing vibration sense by alerting the patients to the fact that they've got a problem and makes them take special care and will save limbs and save lives. Well, how do we normally do it? There are expensive and cumbersome plug-in calibrated vibration testing devices which are usually reserved for clinical trials, but on the wards we use a tuning fork. Tuning forks have got quite a few problems. To my mind, the biggest being that they're not usually available. If they're left out, they tend to vanish because they've got real high street value, and if they're locked away, then they're locked away and it's difficult to find the person with the key. That aside, they're quite large and difficult to use discreetly. They're also metal, so they're cold to the touch and require considerable pressure to impart the vibrations. So typically when patients are asked whether they can feel the tuning fork or feel the vibration or not, they'll say, well, a little. And it's not really clear whether they're referring to vibration or coldness or pressure or a mixture of all three. Tuning forks, of course, are designed to produce a set frequency, a set pitch rather than a set amplitude, and the temptation is always, if a patient can't feel it, to give it a harder whack to see if they can feel that. All the time the amplitude of vibration is decaying away, so actually it's really quite difficult to use them properly. But even so, the biggest problem, I think, is that they're just not available. VibraTip, on the other hand, is pocket-sized and will therefore be much more likely to be available at the point of use. It can be used very discreetly because it's hidden in the hand. It's warm and imparts a fixed amplitude of vibration with minimal pressure. By touching a patient twice at the same place and activating the device just once, the response to which was vibrating, touch 1 or touch 2, is highly specific for vibration and extremely reproducible. The device itself is sealed and easily cleaned with an alcohol wipe between patients. It'll provide about 35 minutes of continuous vibration, which is many months of routine use. Given to a patient, it provides an excellent aide-memoire. It's not that you'd expect a patient ever to test themselves with it, but just having it on the bedside table would remind the patient when they get up in the morning they should put their hand in their shoe before they put their foot in it.